So here we are announcing premiums for 2022, but the biggest news for 2022 for Californians is that next year we're going to have both the Affordable Care Act with the American Rescue Plan working together for the entire year. The American Rescue Plan with the ACA is lowering premiums dramatically. For those getting subsidies, which is about 90% of the people that sign up through Cover California, they're having subsidies pay 70, 90, 95% of the premiums, which means we have 700,000 people, about half of our enrollees, paying $1 a month for brand name plans with really good coverage. Even people who are in families making over 100,000 are getting hundreds of dollars a month to lower their premiums. That's the big news for 2022. It's the American Rescue Plan bringing healthcare within reach to more Californians than ever before. So we're announcing premiums for 2022. The estimated increase on average for 2022 is 1.8%. Now, this comes after 2 years of premium increases of less than 1%. So a 3-year average, 1.1%. That's a low increase for healthcare. We now have more people than we've ever had insured with Cover California, 1.6 million. People are signing up because of the American Rescue Plan financial help, but also because we stepped up to make sure that people that lost coverage during the recession get coverage today, and we built on the state subsidies that rolled out in 2020. All of those are contributing to lower increases than you're seeing across the nation. One of the things about the market in California is consumers are in the driver's seat because they get to pick the plan that works for them. A number of plans have expanded where they're serving this year. Anthem is in about 12 new counties. Blue Shield's expanding. Valley's expanding. We're adding a new plan, Bright Healthcare, in Contra Costa County. In every part of California, consumers have at least 2 plans to choose, but in the vast majority of cases, about 80% of the time, consumers have 4 or more health plans to choose from. That choice means that consumers get to pick the brand name plan, whether that's Kaiser or Blue Shield or Anthem or a local plan like Sharp or Western Health Advantage. Wherever they are, they're in the driver's seat. So not only are we offering more choice for consumers, but we're making sure the choice they have is offering healthcare quality. For 85% of the consumers have picked health plans that are 3 stars or better. What's that mean? Good quality, but we're raising the bar. Starting next year, we're going to actually have penalties for health plans that are lower quality. We're also leaning in to address healthcare disparities, making sure our health plans are addressing health equity issues. We're working with big partners like Medi-Cal, like CalPERS, to make sure we together are changing the underlying healthcare in California so all Californians get better healthcare. When you get a primary care doc, make sure you're getting great primary care. That's something we don't do alone, we do it with other organizations, and we're proud that we're part of delivering better quality healthcare for all Californians. With the American Rescue Plan, middle-class Californians can get hundreds of dollars off their premium if they don't have employer coverage. They should come check it out at Cover California.